The journal article that I selected for this project was called Changes in Maps of Language Activity Activation Following Melodic Intonation Therapy Using Magnetoencephalography, 2 case studies. This article looked at 2 patients experiencing chronic expressive aphasia. I found this article interesting because it allowed me to look at neuroimaging to understand where in the brain language acquisition was occurring. The hypothesis of this article focused on language function as well as the increased activation in the supposedly dead language areas within the left hemisphere. To start off, the patients received traditional therapy such as speech therapy after their accident for a total of 8 weeks. In addition, they were given the Western Aphasia Battery Test. Following that, the patients were given the Boston Naming Test. During the Boston Naming Test, patients were required to sit through neuroimaging to understand where language was being activated in the brain through spatial and temporal activity. Then the patients received melodic intonation therapy, where the patients were required to repeat words and phrases back to the clinician at the same tone and eventually move to a natural speaking tone. And the patients received 12 hours of melodic intonation therapy that were split up into 2 block segments for a total of 3 weeks. In order to measure the changes in melodic intonation therapy, patients were presented with phrases before and after therapy to measure the changes in the language cortex through neuroimaging. This journal article concluded that patients had behavioral and neurophysical changes. The neurophysical changes occurred within the frontal and temporal gyres. Patients acquired more activity within the left hemisphere. As for activation in the right hemisphere, it changed between patients. The right hemisphere indicated the behavioral response. One downside to the study was through neuroimaging. Because the machines are so sensitive, it could skew the results because of the patient within the machine. There are some limitations to this journal article because it only focuses on 2 patients that express chronic expressive aphasia. In order to have a more accurate reading in melodic intonation therapy with chronic expressive aphasia patients, we need to look at more patients. There are some strengths to this article, however, because it looks at MRI imaging and magnetoencephalography imaging and combines them together to allow an understanding of the spatial relationship across the brain to activate language. Ultimately, this article demonstrated there is a positive activation in the brain through melodic intonation therapy and allows an increased activation within the left hemisphere. Melodic intonation therapy is a great therapy for patients experiencing aphasia to help them be able to communicate more naturally. The only thing that I wish that I could learn more from this article was how the neuroimaging process happened and could see the scans of the brain making connections to activate those language areas across time.